Hi, good evening, and a very warm welcome to the Fertility Hub Path to Parenthood seminar this evening. We're going to talk to Dr. Fatin Willendrup on sperm quality. I'm Veronica Montgomery, and I'm the Clinic and Patient Liaison Consultant here at the Fertility Hub. If you have any questions, please type them in the chat box on the side of this YouTube premiere, or if you're watching on playback after the live broadcast, please feel free to ask questions in the comments section as they will be emailed through to us. So let me just share my screen and we'll give a warm welcome to Dr. Willendrup. So let's bring her up now.
Hello everyone, my name is Dr. Fatin Willendrup and welcome to the patient seminar on male fertility and sperm quality. I hope that for the next 25 to 30 minutes, I will be able to answer some of your questions about male fertility and the subject of the semen assessment. First, a little bit about myself. I am a doctor. I've been working in different departments since 2011. I joined ExSeed a little over 2 years ago. I've been working as head of medical affairs. I'm also a former fertility patient myself due to PCOS and low sperm quality. So together with my husband, we went through different fertility treatments. We conceived through ExSeed twice in 2014 and 2016. But last year we conceived naturally our third child. So that was amazing for us. The seminar agenda for today is the following. I want to talk to you about male fertility, the definition and causes of it. Also, we're moving on to talk about semen testing and male fertility assessment. It's important to know the fertility status. Also, I want to share some of our recommendation on what you can do together with your partner to improve your chances of pregnancy. So, of course, we're going to talk about lifestyle changes and what actions do you have to take to improve sperm quality. To start off with, I have a couple of facts here. Infertility is classified as a couple not being able to conceive after trying naturally for a year. And that means that if you are together with your partner have been trying to have intercourse in order to conceive a child, and that has been going on for a year with unprotected sex, and it's not succeeding, that might be a good idea to consult your general practitioner or maybe a fertility specialist, because there might be some issues. Infertility is very common. Actually, 1 in 6 couples experience that. So we need to talk about this subject, and we need to share information and help couples to understand what male infertility and female infertility is. Especially because 40% of the infertility cases are associated with male factors, and that means that it could be because of low sperm quality or no sperm protection at all. So men matter. The last 40 to 50 years, the sperm quality in the Western world has dropped with around 50%, and that's huge. And that's a huge drop, and we need to address also this problem, and we might also take some actions to help the couples that are experiencing infertility because of male factor. All the focus now, all the services, at least most of them are targeted to women, and what can women do, and menstruation and ovulation tests, but we need to also address the male part of this as well. So just a little bit about what needs to happen for pregnancy to succeed. As you of course know that it needs two to tango. We need a sperm cell to enter the vagina and swim. We need a lot of sperm cells, but only one to, of course, enter a sperm cell, an egg cell. So, and also we need an egg to be released from the ovary here and travel through the fallopian tubes. And here the fertilization happen. And you can see it's not enlarged here. Sperm, they swim up and surround the egg, and only one of the sperm cells actually enter the egg here. And when that happens, there is a reaction happening, making the shell of the egg harden so that no more sperm cells can enter. And that is called actually fertilization. So we need good swimmers. We need eggs to be to travel here in the fallopian tubes, and we need the sperm and the egg cell to meet, and also we need this blastocyst also to grow here in the uterus wall and continue to grow for the pregnancy to succeed. What is male infertility? Well, it refers to a man's inability to cause pregnancy in a fertile woman. So that is the definition of it. It is caused either by low sperm production, abnormal sperm function. That means that maybe there are sperm cells, but they're not swimming properly, they're not moving, they don't have the right DNA to go through with the pregnancy, or maybe it could also be a blockage in the male system that causes the sperm not to be delivered or ejaculated into the female vagina and swim up to the fallopian tubes. I have here listed some causes to male infertility, and if you notice here, up to almost 30% of the causes are unexplained. That means that either doctors or fertility specialists, they don't even know why the male has low sperm quality. Other causes are medical conditions, sexual factors, systemic diseases, but as you can see also 15 to 70% of male infertility are caused by varicocele, and I explained that here. That is one of the most common causes. It means that around the testicle there is an enlargement of veins, and they could cause some heat that could have a negative impact on sperm production and quality. Other common causes of infertility are azoospermia, and that is due to a blockage, for example, of sperm production or sperm delivery to the outside by ejaculation. And you can see here under a microscope, this is a normal sperm picture where you see sperm cells. They're swimming, there are a lot of them, but azoospermia is a condition where no sperm at all can be found in the semen. Other causes of male infertility are if the ejaculation is retrograde. That means that the semen not being able to travel to the outside, but it travels to the bladder instead and is mixed with the urine. That is not good. And other causes are if the opening of the urethra is on the outside, and that means if the opening should be here on the tip, but if it's here or maybe lower, it makes it possible for the semen to be delivered when having intercourse, and this condition is called hypospadias. Also, if you have a history or maybe a current present of sexual transmitted diseases like chlamydia or gonorrhea, that could also have a very bad impact on semen quality. That should be treated as fast as possible. When to see a doctor here? Well, if you have been trying out to get pregnant for over a year and it has not succeeded, you definitely need to see a doctor for fertility assessment, both female and male partner. But if you as a male have experienced some of the conditions here, you definitely need to see a doctor right away. And that could be, for example, ejaculation problems, that you're not able to have an erection. Maybe if you have low libido or sexual function is not working. Also, if you have taken a former sperm test and it has had bad results, that is also a good reason to consult a doctor earlier in the process. Of course, if you are experiencing pain or some discomfort or some kind of lump in your testicles, you need to see if there's something important that a doctor has to look at. But also, if you have a history of testicle or prostate problems or sexual problems earlier, and this, you can see that this might be the cause. You need to find out if there are some things that you could do or the doctor can do to improve your fertility status. How can we test male fertility? Well, that's the good question. You do that by making a semen quality test. And you could do that in fertility clinic or just at a laboratory, but also it can be done at home, and I will tell you about that later. And how do we define a good sperm quality? Well, WHO, they have made reference values to the semen parameters that we can measure, and they are listed here. We need to have above 1.5 milliliter of ejaculate to be considered normal. Also, the concentrate of sperm cells per milliliter has to be above 15%. And the motility, that is the movement of the sperm cells, it has to be 32% or above. And the morphology that refers to the shape of the sperm cells needs to be 4%. And these are the parameters that we need to look at when evaluating a sperm cell. It doesn't mean that if you have a low concentration that the sperm quality is bad. You need to look at the total motile sperm cell number. That means how many moving sperm cells we have in the ejaculate. And does it matter? Well, of course it matters. And it is because, well, the higher number of moving sperm cells you have, the better chance of getting pregnant. And if you remember the figure I showed you in the beginning, is that we need sperm cells to be active and swim fast up through the cervix and through the uterus and meet the egg cell in the fallopian tube. So of course we need moving cells. And if you have a huge production of cells, but most of them are dead or not moving, that is not a good sign. So we need to measure the moving sperm cells in the ejaculate. How can we analyze sperm? Well, you can do that by going to a doctor and get referred to a clinic, maybe a laboratory. In there, you will have to ejaculate into a collection cup, and the clinician will need to evaluate the volume of the ejaculate. Afterwards, they place the sample under a microscope and visualize the sperm cells, and they count how many sperm cells and how do they look like and how is their ability to move. But with the current technologies we have right now, it can be done at home. This is an example. It's the ExSeed sperm test. It's a kit with 5 tests, and it is possible to make 5 sperm tests at home. You will need to prepare like this, set everything up and make a sperm sample at home, then transfer a sperm sample into a glass slide and afterwards insert it into the ExSeed device and record afterwards a video with your mobile phone. After a few minutes, you will get the results in your telephone, and you will be able to see how many moving sperm cells you have in the ejaculate. That is the quality of your sperm. very easy, very quickly at home. And of course, you can send this information to your doctor if you want that. In the ExSeed app, you will also be guided on your own fertility journey. You can view your results, your sperm video. You can also get your own personalized lifestyle program to improve sperm quality. I will get back to that in a bit. Also, you can be guided to the best way on how to get pregnant and be connected with fertility clinics if that is what you need. There are many sperm tests out there, but it's really important to pick the right ones. It is important that a home sperm test measure both sperm count, and that is concentration, but also motility. This way we can evaluate the number of moving sperm cells in the sample. It is also very crucial that the accuracy is quite high. You don't want some false results. You also want to test more than one. So it would be good to choose a test where you can, or you choose a kit where you can test several times at home, because there is a natural variation in sperm quality. And that happens throughout the year for most men. So it's important to see if the quality is good now, and also when you want to go try for a baby. And of course, if you make some lifestyle changes, you would want to see if there is a difference between, before the lifestyle changes and afterwards. And also, you have to choose a test who has the WHO guideline as a reference. You don't want something else than these guidelines, because these are scientifically based, and we want to go after these three reference values. So the volume of 1.5 or above, sperm concentration above 50 million, and progressive motility above 32%. That is what we want to compare the sample to. What do you need to do if you're trying to get pregnant and it's not really happening? Well, of course, you want to consult a doctor if you have been trying for over a year, but also you can also do lifestyle changes. You can increase your chance of pregnancy by increasing the number of moving sperm cells. I will get back to that a little later. But also at the doctor, you can also get some medications if there's some problem, hormonal problem, or if your female partner doesn't have ovulation, maybe because of PCOS or other issues, then they can kickstart the process with some medication. Also, if you're not producing any sperm cells at all, but there are some sperm cells in the testicles, but maybe they are not mature enough, or they're not transported into the outside, they can do a procedure called TEISE, and with that doctor extracts sperm cells from the testicle and use them to fertility treatment. We have here the most common fertility treatments, and the first is insemination. It's a procedure where it is necessary to have a moderate or a optimal sperm quality, because you will need sperm cells. They will be injected with a syringe into the uterus. So the doctor helps the sperm cells to get closer to the fallopian tubes where the fertilization happen. This is one treatment that the doctor can offer. As mentioned, it depends on the sperm quality, but if the sperm quality is really low, there are also in vitro fertilization and ExSeed, intracytoplasmic sperm injection. And these two procedures are done when the sperm quality is really low, because they make it possible for the couple to enhance their chances of pregnancy. Eggs will be taken out of the woman, and sperm cells from the ejaculate, and they will either mechanically here with ExSeed inject the sperm cell into the egg, or here they can make them swim or make the fertilization happen in a glass, and then put the egg with the sperm up to into the uterus again, and cross fingers and hope that it will grow into the wall and develop into a fetus. Lifestyle is really important, both for general health, but also for fertility health. Both males and female can do huge things to improve their fertility status. And these are some of the things that men can do. First of all, nutrition is important. You need, as a male, to think about what you eat, both on a daily basis, but your general diet has to be filled with fruits and vegetables. You need to replace refined grains with whole grains. That's also important. You need to take away all the high-fat meat, red meat, and switch that out with more chicken or meat that is low-fat, with low fat. Need to cut off all the unhealthy snacks and maybe pick some healthier alternatives. That could be nuts, that could be fruit. It's important also to lower the consumption of coffee and maybe also caffeine beverages. And I put in this plate. That's what we call a healthy plate, where every time you eat, you need to think about what is on the plate. So half of it should be fertility-friendly vegetables. Some of them are shown here, but also need to have lean protein and nutritious carbs in there. So this has been shown to make a huge positive impact on sperm quality when you take a look at the scientific articles out there. Another really important thing is supplementation. Although you may think that you are getting all the right vitamins, minerals, or antioxidants, you really want to boost this by taking a supplement that contains all the right micro and micronutrients in the right dosages. The ExSeed Multi and the ExSeed Omega are a combination of the right fertility supplements. They reduce the oxidative stress that might be and improve DNA in the sperm. So this is an easy fix that you can take morning and evening, and you can also boost your general health with that. You can see it's good antioxidant and vitamin solution. You also need to exercise. The right thing is maybe 2 to 4 times a week, where you combine cardio and strength training. It's important not to overdo it, like marathon running, bicycling, because that has been shown to have a negative effect on sperm quality. So I've put in a simple routine. It could be cardio training combined with some home exercise, where you have some weights you can use. It doesn't have to be complicated. Everything matters here. Exercise, just put it in your schedule and go for it 3 times a week. When we're talking about lifestyle, we can't avoid talking about toxins. These drugs that I've listed have clearly a negative impact on sperm quality. Maybe alcohol not as much, because it has only shown that if you drink over 20 units a week, that could be damaging. But if you stick to below 14 units a week, that is reasonable. But smoking, marijuana, and anabolic steroids have been shown to have really negative effects on sperm quality. So I would definitely avoid them totally. Also, heat exposure. We know that the testicles have a lower degree body temperature than the body temperature. They need to be almost 3 degrees below the body temperature. So we don't want to overheat them, because that damages sperm production. So maybe change your underwears to a much to some underwear that are much wider, so that they don't produce heat and but also stay off hot baths and also saunas and all of these things that might be of negative impact. If you are weighing too much, that is also that is considerable to change that. Lower your BMI, lose some weight. Here you can also use our training programs to do that. Stay away from electromagnetic radiation, such as, you might know that computers or laptops over the genital area, that is not good. And there are lots of toxins in food. So I would advise you to, don't drink of plastic bottles and wash your fruits every time you eat that. Maybe also buy organic food, and that could also help you. Stress has also shown to have a small negative impact on sperm quality. Try to live a more stressful life, if I can say that. But I think I would advise you to maybe find some good ways to stress off. So it could be mindfulness or exercise, or you can maybe learn to make some exercises with deep breathing or muscle relaxation, maybe even meditating if you like that. Yoga has also been good for males. It's also important to keep a positive attitude, maybe also to structure your day, your week, to feel less stressed. That will probably help you, but you may have your own ways to relax, and if you need also, you could do that together with your partner. So it would be a joint project together. In ExSeed Health, we want to help individually. That means that we want to create a lifestyle program. We have done that to both promote positive lifestyle, but also maybe help you with small changes in your lifestyle in order to improve sperm quality. And we want you to choose the right supplements. We want you to be able to learn to cook properly, to understand what is the healthy nutrition. We have an offer of that with our bootcamp, with the in-app lifestyle program, and we will always answer your questions whether it's about lifestyle or sperm testing. So you are more than welcome to contact us if you want to go ahead and do some actions to improve sperm quality with lifestyle. Our program has been shown to have a positive impact on sperm quality. You can see here that after going through the lifestyle program, we can see a 30% higher sperm quality. So 30% increase in total mortal sperm count for the males that have been through the lifestyle program. We can also see that 50% of the males that have been going through the lifestyle program has changed their quality from the category low to moderate. So they have a 6 to 12% higher chance of conceiving per ovulation cycle, and that's quite good. So we also can see that that we, through the lifestyle programs, through healthy choices, we can improve concentration of sperm cells by 25%. That is also to take home, as you also saw from earlier, that the sperm quality, of course, means that the higher it is, the more chance of pregnancy. So you need to have high concentration, high motility, and a high volume also of ejaculate and low morphology. And this lifestyle program can help you to achieve these goals and maybe help you to a better success of pregnancy. So this is it for my presentation. I would like to thank you for listening. And if you have some questions, if you have some comments to this seminar, I would like you to write or contact us. The website is www.exseedhealth.com, and my email is here on this last slide. So you are welcome with your questions, and I hope you have enjoyed the session we have here.
Thank you very much, Fatin. So just to end off that presentation, if you'd like more information, then Dr. Willendrup and I recorded a podcast a few weeks ago. So if you head over to the fertilityhub.com and look under the news, events and podcast section, you'll see under podcasts, there's a conversation there about sperm quality. Also, if you're interested in any of the ExSeed product range, then you can also, if you look under the news section, you'll see that there's exclusive discounts for Fertility Hub readers, and you can read about what the specific products do in their range. Our next seminar will be on the 24th of November 2020, and that is on ovulation. So if you haven't signed up, that's under the events section on the Fertility Hub. Thank you very much for your time, and thank you for listening. Bye-bye.